gentlemen. So I've got some questions for you, and I'll start with Jeroen. Jeroen?
Sure.
Please describe for us, if you would, how the healthcare market is changing. Who's feeling the stress?
Well, I think everybody's feeling the stress. As a society, we feel the stress. Healthcare costs keeps rising. Just in the US, it's 18% of GDP. And somebody told something very funny yesterday. He said that's more than the entire GDP of Italy and as well organized. I found that really funny. But the burden is on the chronic disease. So about 87% of the cost is chronic disease. And chronic disease is something that you carry with you every day. Every day for the rest of your life. Yet the system is organized around acute care. So what we've been looking for is how can we engage that patient much more? How can we make sure that we continuously support them? And I think these are the challenges we like to address. The challenges of putting the patient back at the center of healthcare, controlling the cost and improving the quality. That's what everybody's striving for, but that means a change of the system.
So Dr. Newman, how do you respond? How does the Salesforce respond to this sort of changing environment?
We see the same factors, the same pressures happening that Philips sees, and I think everyone sees them at the same time. All kinds of new pressures, whether they're business pressures or consumer expectations or the changes in how people are practicing clinical medicine. Everything's sort of changing at the same time. And I think depending on who you are, depending on your organization, or depending on your perspective, you want to solve the problem in a different way. Some people are doing very small incremental steps, and some people are having huge piecemeal changes in how they're doing business. And I think the trick is going to be, how do you set yourself up for the future, and how do you set yourself up for some of the big changes that we see coming? I remember a few years ago we were here and people started talking about population health, and they started talking about value-based reimbursement, and no one really knew if it was going to stay or not. No one knew whether they should make these huge investments to accommodate that or to handle those pressures. And I think now we're starting to see it's here to stay. It's only going to get stronger and bigger. And really the pressure is on those organizations to get ready for those changes.
Yeah, you already see new reimbursement models like DISRIP, where the IDNs are forced to think differently about how they engage with patients, how they measure improvements in care, how they measure and stratify population and find the right programs to tune to the needs of those patients. And where I come from is nothing new. 20 years ago, I was with Citibank, and we did this thing called customer segmentation. So we looked at the needs of customers, and we started identifying products and services around it. I think that's the stage we're entering as well. We really want to understand who are those patients, where are they on their journey, how can we best identify them and find the right services at the right cost, proving the best outcomes. And that's very much going to be a data game that drives that. So there's a reason why it's only happening now. The reason is, right now we have the technology to measure, we have the technology to engage patients, and we have the technology to engage patients to a healthcare system.
Right. Okay, so this is a big question. I'll ask you, sort of throw it to you both, and feel free to sort of toss it around yourselves. But what is exciting you about the industry right now, about the healthcare industry? And it might be two different perspectives, right?
Well, our perspective at Salesforce, the most exciting thing that's happening in the entire world of healthcare is the Health Cloud. And that's a new product that we just announced that's generally available starting yesterday, and we're pretty thrilled about it. It really takes Salesforce, the technology, the architecture, the cloud-based work that we do, our cloud, our social, our mobile capacity, and it brings it to healthcare sort of in a new way that's never been seen before. We took a lot of the learnings. We've been in healthcare for a long time. We've been in clinical care for as long as I've been at Salesforce, was almost 7 years. But people in the past had to take Salesforce and they had to customize it their own way. With Health Cloud, we're going to give people a chance to go live with Salesforce technology for taking care of, reaching out to, engaging patients in a way that really haven't seen before, and we're thrilled about that. This is our first HIMSS in the way that we're doing it now. This is our biggest third-party event in Salesforce history. We're showing, obviously, commitment to the industry, but for me, I took an oath to really take care of people, and it's thrilling and really quite an honor that I can be here at this moment to launch Health Cloud.
Awesome.
Yeah, I'm also excited about Salesforce Health Cloud because we've been working together for 2 years now. We see great complementary capabilities. We already implement our care coordinator on the Salesforce platform for the simple reason that our thinking was, okay, what is CRM? It's customer relation management. You organize around customers, you collaborate around customers, you communicate about customers. So when Josh and I met, say, okay, now let's replace customer with patient. And let's look at how can we engage patients, how can we have care teams, collaborate around patients, even if they sit in different organizations. How can we use tools like Cheddar? How can we use the great technology in Salesforce to really create that collaborative care? I think it's addressing some of the biggest issues in our industry, which is truly engaging patients. And if you combine what we're doing Salesforce with our own digital platform, where we now already have hundreds of devices connected out of the box, where we can take in data from EMRs, but also from imaging systems, even from digital pathology, from wearables, and you see a whole range of consumer wearables, but also professional wearables for in the ICU. I think we're at the dawn of a complete new age of healthcare. And I think there's nobody in the industry that can solve this alone. What you see in industries that are struggling with big challenges, there's people who come in with experience from other industries and apply it to this industry. And I think that's what attracts me in Salesforce. I myself come from the financial services industry. Now, I thought that financial services industry was complex until I learned about healthcare. I think it's a couple of steps up from financial services. But then again, 20 years ago, my team launched internet banking. You can go anywhere in the world. You go to India, you stick in your card, it gets authorized in Amsterdam, and you withdraw money. Right now, today, if something happens to me, nobody knows my medical history. There's no way they can get access to my clinical background because I live in the Netherlands. But the same thing applies for, Josh here in Las Vegas while he lives in San Francisco. So I know it's more complex in healthcare, but I also know there are some very basic capabilities that we can bring to bear pretty quickly. And also 20 years ago, a lot of people told me, nobody is ever gonna bank on the internet. Don't waste your time. You are excited about your internet banking, forget it. So still, I'm in a lot of discussion today about, people don't want to put their patient data in the cloud. And I go like, what? Of course they do, as long as they know that their privacy is guaranteed and that you do it on a secure infrastructure. So I think we're creating the technology environment where people truly can trust their data in the cloud. They can trust the security that we apply because we encrypt everything. So, all the breaches in healthcare is clear data. Encrypted data doesn't make sense to anybody. So we designed security in from the start, and whether you do it on premise, I think actually much of the data will be better off in the cloud. But there's another reason why you want it in the cloud, because you want to share the data. You want to share it between the hospitals, the GP, the specialized clinics, but maybe even your wearable data, but also the information that we create around who you really are in terms of your cell structure, your genetic makeup. And if you walk around our booth, you can see that we bring together all that information in the cloud, surround it with a layer of security, and then expose it, for instance, into Salesforce, so that these teams can really work together. And I think that's only happening now, that we can do that at scale, securely, and create complete new models for care.
And convincing people that it's secure is the hurdle. Is that right?
Yeah, I think it's also education about information technology. And of course, we're in an information technology conference here. Yeah. But the assumption that if you put it in your own data center, it's more secure, is not the right assumption. Because these data centers are also full of legacy systems that have exposure. If you put your data either with us or with Salesforce, and we're storing our data in Amazon Web Services, both companies guarantee a much higher set of security measures than any, data center can do on their own. Because they know that if somebody will breach a Salesforce cloud, it will be the end of their business. So,
yeah. Okay, so
you probably want to comment on security.
Well, I think what I would say is that from a multi-tenant perspective, we have a lot of customers, and the nice thing about Salesforce is that every customer gets advantage of all of the security and all of the work that we do for every other customer. There's a whole lot of work we can talk about, and a whole lot of technology that we have that we bring to bear, and a lot of ways of talking about it. But I think that I want my servers in the basement because I want to hug them every night. Yeah. I think that's over. And we heard from a lot of people for a long time, we won't put personal data in the cloud. We're a hospital. We have to own this data. But frankly, we saw those same kinds of concerns 15 years ago in every other industry.
With Salesforce, Mark told me that when he started the company, a lot of people said, well, your customer data is your crown jewels. You're not going to put that in the cloud. Now look at where you guys are.
Yeah, we've actually had to, in healthcare, because it's such an important world for us, and it's sort of new for us in some ways too, we've had to dust off our old playbooks. Like, how do we convince people that it's safe? How do we show them that it's a really much better way of doing it? And again, it's not the security. I think the real benefit is when you're in a multi-tenant platform, you wake up in the morning and there's new features. Yeah. Just like we wake up in the morning and there's new features on Gmail, or there's new features on all the kinds of services that we use. It's really the benefit that draws people in. It's not, you can talk to the security concerns. We can speak to those. Yeah. But it's really benefits, return on investment, lower total cost of ownership. That's why people use the cloud.
Yeah, and of course the elasticity. If we start doing these really advanced oncology cases where we, combine images with digital pathology, with genomics, and then we want to aggregate it over 100,000 cases and analyze this, you need a whole lot of compute power. Also, if you look at the marginal cost of storage and compute power is very low in the cloud. If you want to do that on your own data center, you have to buy new rack, and you have to buy for peak load. And in the cloud, there is no such thing as peak load. So I think there are a whole bunch of advantages that I think the healthcare industry will embrace pretty shortly, because they will see the tremendous benefits of very rapid functionality, scalability, and cost, and guaranteed security and privacy. So I think if people really tap into that, they will start seeing that they can do much more than they're doing today.
So you both talk about doing things for the first time, sort of a new dawn, but is there a model for healthcare beginning to form yet, or?
Yeah, I see a new model emerging, but it will take time. So, of course, everybody talks about the shift from fee-based service to value-based care. So instead of paying for inputs, paying for output, paying for results, paying for outcomes, and contracts are getting structured that way. Now, in order to do that well, you need to measure. So we'll see that people are getting truly interested in population health, because their revenue will depend on it. They're gonna take risk for their contracts, and as they take risks, they're gonna engage patients, because they will get better outcomes. The better their outcomes, the better their bottom line. So there is a real incentive to rethink models. Yeah. And then you find out that a model that's purely based on acute care is not gonna hold up. That prevention actually pays. That keeping people out of expensive procedures will not only make the outcomes better, it will also be financially attractive. So as these worlds are coming together, and then from the third dimension, you see the technology capabilities, you can kind of visualize where this is going. It's going to a place where patients self-manage, they tap into a 24/7 network. If they need acute care, hopefully proactively they will be notified that they need to come to the hospital. As they come to the hospital, people will have that full profile of the patient. They can go to any of our definitive diagnostic capabilities and truly have a personalized assessment of their condition, and can create a truly personalized treatment plan. Now, what I'm talking about is not years away, but fully scale it out and make it work may take a couple of years. But the technology is here. The first reimbursement models are there, and the first IDNs that get it are actually on the way. So there are people that we can look up to and say, hey, they've proven that this work. For instance, Banner Health has some very, very interesting results. And actually, our e-care coordinator, the core of this, is also using Salesforce technology to power it. But there we've seen that for the sickest patient, we reduce readmissions by 47%. 47%. We reduce emergency care by 67%. And we improved the net cost of delivering that care by 27%. And now comes the most important part. Actually, these patients are happy. They live at home. They live with dignity. They don't have to go through the humiliation of, in a hospital bed, not seeing their wife. So I think ultimately what we're doing, we're creating a much better condition for the patient.
Awesome. Anything?
Jeroen, you spoke about some great reimbursement side of this and how people might practice differently. I'll talk about a different piece of how we see things changing, and it really comes from everything that we've learned and everything that we see outside of healthcare. So we know that we spend about $3 trillion a year on healthcare in the US, and some people have estimated that the amount of waste is up to $1 trillion. Up to a third of that is waste. And so when you think about that problem and you think about how we don't score as well as we could on clinical outcomes all over the place, you see that there's a huge opportunity to make things better. So what do you do when you want to make things better? You move fast, and you're agile, and you're innovative. So now this is where we talk about outside of healthcare. We're all sort of cursed in a way because we're in healthcare. And by that I mean we see every other industry and how quick it is and how easy it is, and we all have smartphones and we all use Uber and Amazon and Pandora and all these great services, and then we show up in healthcare and it doesn't work like that. Everything is either monolithic in one system, or you're stuck somewhere, you can't move as easily, you don't have as much data.
Silos.
You spend way too much money on something that you should. It's sort of the old airplane model where you sit next to someone who's spending half the price on a ticket than you are. Same thing happens in healthcare all the time. So in addition to the fact that we're cursed, we're also really privileged because we can look at every other industry, and I would argue that where every other industry is where healthcare is going to go. We're going to see greater flexibility, we're going to see greater transparency, and we're going to see a greater hybridization of the kinds of solutions that are out there. So rather than having to buy everything from the company store, in this case, the old company store was the hospital or a single EMR, we're going to see all kinds of hybrid solutions, which is why what we have is pretty cool. One of the things that came up when we first started meeting was, what do you guys do? What do? We said, look, we have great pipes. We've got great architecture. We're really the world experts when it comes to engagement and a platform for engagement. But Jeroen, we don't know about healthcare. I'm the only MD at Salesforce. We don't know about clinical protocols. We don't know about the algorithms. We don't know about the thresholds. And we don't know about the devices. So if we're going to solve problems together for patients, we need to start to work together. Yeah. And we're seeing the same thing inside of hospitals. When I was trained as a family doc, no one trained me how to collaborate with other specialties. They trained me how to do nutrition and exercise and mental health and smoking cessation and getting people ready for surgeries and all of that. Right now, we see the most successful organizations are the organizations where they give people discrete tasks. They measure them on those tasks, and they make sure they're really good at them. The hospitals that have the best outcomes, that have the fewest adverse events, are the ones that do the same things over and over again. As we see more and more, I think we're going to see in technology the same kinds of things. So Philips is great with devices. They're great with imaging. They're great with thresholds. They're great with these clinical services. They're partnering with us to use this platform, and hopefully we can find more partners and really increase the ecosystem, which is another thing to Jeroen and Philips' credit. From the very beginning of our partnership, the goal was to make this open for as many people as possible, and that's in our ethos as a company, and that's absolutely in our prime axioms as we're figuring out how we're going to treat healthcare.
Now, I think talking about the ecosystem, so if you walk around, there are many small companies that have great innovation, but they cannot scale it. It's only a point solution. So what we've been discussing extensively as well, can we create an open platform that allows us to take care of the core infrastructure, and not just a technology platform, but ultimately also a commercial platform, so that we can embrace these innovations, certify them, and basically say, hey, here is a platform for you to innovate with us. Because there's no way anybody in the world, no single party, how much money they spend, will be able to solve all these challenges. But together, I think we can come a long way by bringing in Salesforce, by embracing some of these young innovative companies, by working together with the medical research centers, And we're even working together with people who you might consider competitors, because sometimes you have to work together to solve a customer's problem. So I think that's a shift in the way we work as well, because for us, we're great in devices, but we're also beyond devices. Devices are critical to our proposition, but these devices need to be basically wrapped around software. Software needs to be enabled functionality, need to create clean data that can be shared. And more importantly, that provides a foundation for completely new models and services. So you'll see Philips becoming much more of an ecosystem player, where we jointly team up with people like Salesforce. So together we can take on these really big challenges and make these changes that we were talking about.
So these are big challenges, and I'm going to bring us back to the catalyst thing and sort of bring it in. I mean, I know that you have a very personal catalyst for change.
Yeah, I think many people are motivated by their personal experiences. So actually, my daughter is here on the booth. She was diagnosed when she was 12 with type 1 diabetes, and it always amazed me how the system worked. So we lived in New York, and she had issues with, multiple doctors, a dermatologist, a diabetes nurse, intensivist, GP, nobody ever talking to each other. Then she was using this technology, and none of it was connected. Then we started looking at apps, and we found there are 100,000 apps, but very few of them validated apps. So very hard to find validated, evidence-based information that's personalized. So as we got deeper and deeper into this, and she moved to the Netherlands, she found exactly the same problem. So we started looking at how can we apply technology for her to manage her condition, to feel better about controlling herself. And then, and Josh knows her as well, because we've been working together with them as well. And then how can we leverage the Salesforce technology to create these professional communities of the psychologist, the nutritionist, the GP, the intensivist, the dermatologist, and I can go on. How can these people work together by using Cheddar? How can we create workflows that allow this to be managed? And how can we pull in the data from those devices and allow her to collaborate with her professional care team? But I also want to be on her care team. And she also wants to be in a community where she can securely exchange information with patients like her. So the needs are very well defined. And I think the technology is also pretty well defined. So I think we're now at a stage where we can tie that together and start packaging that. And then we need, of course, the healthcare systems, the IDNs that say, hey, this truly helps people with chronic disease to improve their condition. It truly helps them to avoid deterioration. It helps pre-diabetics to move to that state of diabetes. And I think it's a tremendous opportunity that I hope next year we stand here and we can be proud because we have millions of people actually proving that they get better.
Do you have anything to add to that?
Well,
personal example.
I'm really proud to say my wife had a baby a month ago. It's really cool.
Hey,
really cool. My first child. It's really excellent. And I meant to call you or send you an email because I'm sitting for 30 hours in this labor room, and there were 4 or 5 or 6 machines that were Philips machines. And it's funny because we hang out at these tech conferences and we all have a way of talking to fellow colleagues in technology and talking about health information technology. And sometimes, and we have all these meetings all the time, and I sometimes forget, really, I'm embarrassed to say as a doc even, that there are actual people using these things and feeling feelings and scared and all kinds of issues that come up. And so I think my personal story is really is 2 pieces. One is the actual experience of having a baby and having a baby in the hospital and coming home and having all kinds of questions about it. And I'm a doc. I'm a family doc. I've delivered babies and I still had questions. And we didn't really have a good way of asking those questions and getting those questions answered. And I think the other thing is even more important. It's a little more conceptual, but it's even more meaningful to me, which is once you have a kid, and I know you're this way too, once you have a kid, your scope of care changes. You're not just caring about yourself anymore or the amount of time you're going to be alive. You're caring about your kid and how long your kid's going to be alive and what the world's going to be like for your kid as they live. And what we see more and more and more are people realizing that if we want to cure cancer, prevent cancer. If you want to cure chronic heart failure, prevent heart failure. And there are a lot of ways we can do that. The ways of doing that are not more medications and not more procedures and not more, imaging studies, although some are good. The answer really is around relationships. It's around taking care of people at home. It's around giving them support, giving them behavioral support, and making sure they're going to be healthy for their whole lives. So my personal story makes me feel that way. We're really psyched to see Philips making a profound change in their business and taking on, a really big challenge, which is getting out of the hospital and into this new care setting where we don't really know what it's going to be like. But I really got to give these guys credit for taking that responsibility and taking a step and making a stand. And we're really thrilled and honored to be doing it with them.
I love to do that together with you, Josh.
Thanks, Jeroen. Me too.
Thanks.
So, gentlemen, we're close on time, but do you have a moment for a question or two from it?
Yeah.
Okay.
Sure.
Any questions? Feel free. Now's your shot. All right. Okay, here we go.
What's the main catalyst then for getting more people kind of in the cloud or connected? Is it through facilities and health organizations, or is it a sort of independent person-driven move like signing up for Facebook or something like that?
Yeah, I think that's an excellent question. So let me talk a little bit about the Netherlands. So in the Netherlands, there are about 60 hospitals. Everybody's doing small pilots, and they've recognized that they're not going to get at scale. So some of these regions have started working with us to create an infrastructure to do that. And the Ministry of Health is very interested because they set a target for e-health. They call it e-health. And they basically said by 2020, 80% of all chronic disease patients should be able to get their data, manage their data, and they should be able to get 24/7 help. Now, that's a great goal. So we started looking at how can we do that at scale. So ultimately, we're going to look at, is this going to be fully reimbursed by the insurance? Is this maybe going to be subsidized by the government? But we've seen that a lot of people jump on it and say, okay, we'll figure out the model as we go, but we're going to go for the goal. Now, similarly, we see that IDNs that are contracting for at-risk contracts have a big motivation to get there. And as they evaluate the options, I think, and they have pretty mature IT organizations and strong CIOs, they will look at, a joint Salesforce and Philips solution. They will say, this is, world-class cloud technology that can link back to our on-premise. And I think they will see that this is a solution that can scale and work.
I like to add to that, if possible, from a different perspective. It's what makes a CIO, what makes a hospital ready to consider the cloud, or what makes an IDN ready to consider the cloud. I'm going to think about it from an applications or a functional standpoint. First of all, the first thing you should say to anyone who says we're not going to put our data in the cloud, say it's already there. If you're doing e-prescribing, if you're doing billing, you're already sending your data off your system onto some other system, and they're supporting it. And that's really where the answer is. As soon as people find that they need things that extend beyond themselves, they're going to need the cloud. Portals are a good example. Decision support from some central location that has data on millions of patients, that's not going to come from the hospital. When people start needing multiple services from a vendor like Philips that has all the device data in one place, when they start finding they need to extend out and to have one point to connect versus many points to connect, they're going to start putting their stuff more in the cloud. So the best example of it, and the example that I know that's really close to Philips' heart, care at home. If you're taking care of someone at home, you can't really rely necessarily on your server in your basement because you have to build an endpoint to every one of those homes. And that can be hard, tricky, and fraught with all kinds of challenges around security and privacy and connections and all of that. So I think the more people start using modern technologies, the more they're going to be thrust into the cloud. It's not even going to be an issue of choice. It's going to be cloud or nothing. There's not really an alternative in these cases. And we're thrilled about that because what it means not only for our company, our company is great and our company is going to really enjoy that, but as patients, as consumers, as people in a country that's wasting so much money on this stuff, we finally have an opportunity to help modernize it, and it's going to happen from this kind of technologies.
All right, gentlemen, Dr. Newman, thank you. Thank you both very much.
Thank you.
We appreciate that.